Security as well, okay? If you are coming to us from an ISD, as long as you have been here 5 service years at SFA paying into the Social Security system, you will retire underneath our rules, but you have to have those 5 years, okay? If you're coming from an ISD that did not pay into Social Security. Now, we're going to talk about TRS retirement first, and then we'll go into the ORP retirement. But with TRS, they have 3 types of retirement. They have normal age retirement, they have early age retirement, and they have disability retirement. Today, we're only going to cover normal age retirement, okay? Now, with the letter that came out from President Gordon, he offered the VSIP program as an incentive program. It is in addition to your retirement, okay? And so this is for people who qualify for normal age retirement and will meet that in fiscal year 21. So that means September 1, 2020 through August 31, 2021, okay? You are eligible to apply for VSIP, okay? If you want to participate in the VSIP program, you have to have your application filed by July 31, 2020. If you wait past that date, it won't be there, okay? So you need to apply now by July 31st, 2020. And the way that you do that, as you go out to SFA, My SFA, you click on the Employee tab. Underneath Benefits, you're going to find this. It says Request for Consideration in the Voluntary Separation Incentive Program, VSIP. You click on that and fill out the information. Once that is filled out, it's going to send me a notification, and then I'm going to look to see if you meet the normal age retirement for fiscal year 21. If you are eligible, then I'm going to send your VSIP application to the next step, to the next process. Then they're going to look at it and get with the department and see when you can, if you're eligible for retirement and when you can go out, and we're going to call you in August. So everyone that is applied for VSIP, we're going to make appointments in August, call you in, sit you down, go over it, find out when you're wanting to retire, tell you if you qualify for the VSIP program. You are not, if you sign up for the VSIP program, you are not binding to that, okay? It's just an application. The agreement, once everything is talked about and you agree to that, those agreements are going to come out September 1. And you're going to have up to 45 days to review that. And if you, once you sign that, the agreement, you have 7 days from that day to withdraw, okay? And so you're not bound to VSIP or retirement until you tell us, I'm going out for sure, and you sign, and you let your 7 days pass after signing, okay? So a lot of people were concerned that I don't want to apply for VSIP because I don't know if I want to retire yet or not. Well, you're not bound to it by just applying for VSIP. Another question that we've had with the VSIP program is, am I going to be giving up my vacation payout? Will I still get that and the VSIP? And the answer to that is yes. If you have accumulated vacation time or comp time that you have not taken or haven't been paid for, then you get a vacation lump sum payout still, okay? Another question that we're having is a lot of employees go, I want to retire on this date, and they'll give us a date. Your department, we're all going to try to work to help you get that date, but we also have to understand if we have 10 employees going out of the department at one time, we also got to make sure that that department, the students' needs and everything is being met. So we might have to say, can we stagger a few of you going out at different times and work with us on that, okay? There was an update yesterday that came out on the return to work retirees. In the initial letter that came out, it said if you retired, you could not return to work as a retiree for 2 years. And that has been updated. If you're an ORP retiree, you can come back immediately, but only at 50% or less, okay? But if you're a TRS retiree, TRS has a rule out there that you can't return to work before 30 days, because if you do, you'll forfeit your TRS retirement. So a TRS retiree has to wait at least 30 days, but you're also going to be, if you return to work, 50% or less, okay? So those are the updates on VSIP. But it is, again, it is in addition to your retirement. It's not taking away anything from retirement. And remember that deadline, July 31st, 2020. So now we want to talk about normal age retirement in TRS. It's very important with TRS that you, the employee, understand what tier that you're in TRS. And you're based on your tier of when you were hired. So you start at the very top. And it says, did your current TRS membership begin prior to September 1, 2014? Let's say yes. Did you have at least 5 years of service credit on August 31st, 2014? We're going to answer yes to that one. Did your current TRS membership begin prior to September 1, 2007? Yes. Were you ever a member of TRS prior to September 1, 2005? Let's say no. Then that makes you a Tier 2 employee, okay? And so that puts you at a certain rules and guidelines for retiring underneath TRS, okay? And so it's according which tier that you're in. And so that's important for you to know. Now, when you get ready to retire in TRS, the eligibility for normal age retirement is that you have to be vested in TRS. You have to be in the system for 5 service years. You have to either be age 65 or meet the rule of 80, okay? And the way you meet the rule of 80 is your age plus the number of years that you have in TRS, service years that you have, equal 80. Let's talk about, once you meet the rule of 80, now I talked to you about tiers, and it's important what tier you're in. If you became a member prior to September 1, 2007, the combination of any age and your service years, you can retire. So if you meet it at 50 and you have 30 years of service, that totals 80, you can go out at the age of 50 if you're in this tier. But if you became a member after September 1, 2007, but prior to September 1, 2014, you have to meet the rule of 80 and you have to be at least age 60, okay? Now, someone who became a member after September 1, 2014, you have to be at least age 62, all right? Now, before we go into the standard annuity and how TRS looks at that, I have a lot of people who come in and say, I came to work May 1st, 2008, and this May I got my year of service. That's not how it works with TRS. TRS looks at September 1 to August 31. And if you've worked during that time, and right now the rule is 90 working days during that time, you will get 1 year of service credit. It's not your hire date to the next May. It is from September 1 to August 31. So for those people who came in May and they had never worked for TRS before, they did get a service credit from May to August 31 that year. Okay? Their service started September 1 to that August 31. So that's why we always want to check to make sure how many service years that you have. Now, when you apply for TRS retirement, TRS uses the following guidelines. They take the average of your 5 highest salaries, not the last 5, but the 5 highest, and they get the average of those. Then they take the total number of service years that you have, and they times that by 2.3%, which gives you your percentage of pay that you're going to receive. They take the total percentage times your average salary. It gives you your annual annuity, and then they divide that by 12. And so we just took this with someone who makes $36,000 is their average salary. They were here for 30 years. We times it by 2.3, which gave you 69%. We take that times 36, gave you 24,840. You divide that by 12, this person's going to receive $2,070 a month on their TRS retirement. Standard annuity is the highest amount that you can receive. TRS also gives you other options at retirement. As you can see, the standard annuity is 100% of the amount that was just figured. But some want to be able to take care of, say, a spouse who is going to be your beneficiary. You have the choice, if you don't want to take standard annuity, and let me explain again what standard annuity is. Standard annuity means that you're going to draw 100% of it, and at your death, it ends, okay? But they offer you options 1, 2, 3, 4, and 5. Option 1 means, let's say that you have a spouse and you want to leave 100% of your check to a surviving spouse if you were to decease, okay? That means at your death, your spouse would draw the same amount for the rest of their life. Option 2 means that they could draw 50% for the rest of their life. I'm going to skip down to option 5. That means they could draw 75% for the rest of their life. Now with options 1, 2, and 5, if a spouse was to decease before you, they raise you back up to the standard annuity amount. Okay? Now, options 3 and 4 are probably, nobody really uses those. But they're out there for you. Some people may like it. What this is, they're a little bit different. One of them is 5 years and one of them is 10 years. Okay? So what this means is that they will give you an amount there, and they tell you with option 3, you can draw this amount for the rest of your life. But for the first 5 years, if you were to decease before you had drawn 5 years worth, your spouse, let's say your beneficiary, can draw it for the remainder of the 5 years. Okay? Or you can go with option 4, which is 10 years. So if you were to decease at 4 years, then your spouse could draw it for an additional 6 years. Or if you decease at 9 years, they could draw it for an additional 1 year. Okay? But those are the options that you will have, and you will decide that at retirement when you get your paperwork from TRS, and they will have those amounts there for you to look at. Okay. Now, standard annuity will be reduced for one or more of the following reasons. Remember, standard annuity is the most that you can draw. But if you retire at early age, you don't wait to normal age, then they're going to reduce that amount. Okay, so you have to meet all those qualifications for it not to be reduced. You're eligible based on your tier, and you elect a partial lump sum or other reductions required by law. What a partial lump sum is that first tier that we have, a tier 1. Those people are considered grandfathered. They were in the TRS system a long time ago, and they were grandfathered. their salaries is not going to be based on 5 years, it's going to be based on 3 years. And another thing is they're going to be eligible for the partial lump sum. That means you can get a lump sum payment paid to you, and you can draw a monthly annuity amount. So you'll get a one-time lump sum payment. For the rest of us who are not in that tier and we're not grandfathered, the only way that we can get a partial lump sum like that is to meet the rule of 90. I've had several employees, it's like, I have to have the rule of 90 to retire. No, you have to have the rule of 80 to retire, but you have to get the rule of 90 if you want that partial lump sum option, okay? Now, if you elect one of the optional retirement payment plans, 1, 2, 3, 4, or 5, instead of the standard annuity payment plan, they lower that amount. And they will show you when they send your paperwork what that amount will be. So if you go with something other than standard annuity, it will be a different amount. In addition to our retirement income that you will be having, TRS also furnishes to us a death benefit for a retiree. So when you're deceased, there will be a $10,000 death benefit to your beneficiary that you've left as your beneficiary. If it is a spouse, they are going to have the option of either taking a lump sum payment of $10,000, and taxes is held out of that because it's a death benefit. It's not life insurance. And so, or they can say, I want a $2,500 lump sum payment, and then I want to receive $250 per month for the rest of my life. Okay, that's what your spouse can choose. In addition to if you've left the retirement income to them as well. So they could get a retirement income check plus an additional $250 per month once your spouse reaches age 65. Okay, they get that $2,500 lump sum payment in that. Now, to a beneficiary that has a spouse who has one or more minor children, it's $350 a month instead of $250, and it's continuing until the youngest child reaches 18. At age 65, your spouse will be switched over because your children have reached 18 and they have fallen off. Then your spouse will be switched over where they can draw $250 a month for the rest of their life. Okay? Now, if you have no spouse and you just have minor children, they can receive $350 a month with 2 or more children less than age 18, and $250 per month for one child until under the age of 18. Payments cease when that youngest child turns 18. Okay? TRS service credit provisions. I have a lot of people want to know, can I buy service time? Or how can I get some additional service time? You can purchase limited amounts of eligible service credit like military time. If any of you have military time, you have to be in TRS for 5 years, and then you can buy military time or out of state service credit. Okay? Previously withdrawn TRS service credit, so if you withdrew TRS, you can purchase those years of service. If you have state, sick, or personal leave service credit, you're eligible to draw to purchase up to 1 year of sick time. Now, the way the TRS sick time is you have to have at least 400 hours to be eligible to purchase it, but you have to purchase it separately. The 400 hours just qualifies you, okay? And the cost of these services are determined by TRS. So if you're interested in buying any of this, reach out to TRS, go to their website, log into My TRS, and once you log in, you'll see all your options over there, and you can request to buy any of those service times, and they will send you that out. And when you buy service time, they give you options for buying it. You can either do a lump sum payment, They go all the way up to 5 years letting you pay that out, okay? And so with a previously withdrawn service credit, you just have to get your first check, get up and in the TRS system again as an active employee, then you can reach out to them and buy that service credit. You don't have to wait 5 years on that. TRS service credit provisions. TRS members with at least 3 years of TRS service credit, and if you've ever worked for the ERS system before, you can take and combine those years of service at retirement. That's what we call proportionate retirement. And so you can combine those. Other than Texas public retirement plans that participate in proportionate retirement program, certain cities, counties, or other governmental entities such as TMRS, TCDRS, City of Austin, Austin Police Retirement System, El Paso Firemen, and the Police and Pension Fund at El Paso, and City Employees Pension Fund. And so any of those, if you've had worked there before, even if you have withdrawn funds, you can still get the service years counted for those with TRS, okay? So if you've had any of those, be sure and get a letter from them stating when you work there, and we'll get that to TRS, and they can look to see if that will help you get you your rule of 80. It will not help you with the retirement amount that you get each month, but it will help you to get to the rule of 80. Okay, so you've looked at this and you say, I'm ready to retire. What do I need to do? The first thing that you need to do is contact TRS and let them know that you want a retirement packet, okay? You can do that by calling this number, or you can go online with TRS. If you go online with TRS, you will log into My TRS, and once you get logged in, this is My TRS at the top. Once you get logged in here, or if you've never been out to that website before, you'll need to register. And this is what it looks like, okay? So, be sure and check your name and address, your date of birth, okay? Because this is where they're going to mail your packet to. So we need to make sure it has the correct address. Now, if you've updated your address in the SFA system, it does not take care of TRS. TRS wants you to complete a form to change your address and send to them, okay? You can get that form at this same website, and you can complete that and get that mailed out to them. But if you're requesting a packet and you call them, they'll usually try to help you get it to the right address while you're on the phone with them, okay? When you go here, it's very important to look, years of service. Okay, that tells you exactly. You'll be up to date how many years of service that you have. And here's your membership tier right here. It tells you what your tier is. So there's the information that you're needing to look at for retirement. It's going to have your salaries here, and it will have the 5 highest. Unless you're a grandfathered employee, you're going to see 3 salaries there. Okay? Now, over here on the left-hand side, it says request retirement estimate or packet. That's where you need to go, and you need to request a packet. It takes approximately 60 days for that packet to get to you. They will allow you to give them 2 days. So if you're not sure when you want to retire, if you're thinking maybe December or maybe May, or even maybe August. So you decide on 2 dates, or you can just give them 1 if you know for sure what you're wanting to do. And they will send that out to you. Now, something I want to tell everybody is the year that you're retiring. Remember how I told you they count your service credit from September 1 to August 31? But on the year that you're retiring, they will allow you to work from September 1 to December 31, as long as you're paid for that full month. So when we're on those Christmas holidays, you've got to make sure that you're paid every single day to December 31. They will allow you to count that as 1 year's service, only on the year that you're retired. Now, one thing that it does not allow is, remember how we're saying your 5 highest years? If you go out in December, they'll allow you to count it as a year of service, but they will not count your salary from September to December, or from September to August. They won't let you count that salary because you're going out in December. So if it's going to be one of your high years, the only way that you're going to get that salary is if you go all the way through to August 31. Then you would get the year of service and the salary. Okay? So just keep that in mind when you're looking at retirement. That is TRS retirement. And how you go online, how you request that packet, they will send you that packet in about 60 days. Once you get that packet, you can contact me and we can sit down and go over it, or you can fill it out and send it back yourself. It's whatever you feel comfortable with. We're going to be here for you, the employee, and what you need help with. Okay? Now we're going to talk about ORP. Optional retirement. First of all, you are vested with ORP when you have been in the program for 1 year and 1 day. And you have to meet the rule of 80. That's age plus years of service, okay? Or you're age 65. So basically the same thing as TRS, except the vesting time. You're vested after 1 year and 1 day, okay? Now, meets the rule of 80. That is, any age meets the rule of 80. Ready to retire. Steps that you need to do is an optional retirement program retiree. First thing you need to do is contact your vendor that you're sending your retirement funds to. Let them know, hey, I'm wanting to retire and I'm looking at going out on this day. They're going to sit down with you and come up with a plan and show you where you're at. As a retiree, you have the option of drawing all of your funds out on an annual basis. Let me restate that. You can draw out funds on an annual basis, or you can draw it out on a monthly basis, but you will never, ever, as an ORP retiree, be eligible to draw all of your funds out of your ORP account. The rule to be able to keep your health insurance is you have to maintain an ORP retiree account with SFA, okay? And so that's very important to remember. I have some retirees who say, I want to move my funds over to this vendor that's not with SFA. You can do that, but you have to still maintain funds over here with an ORP vendor that is associated with SFA. Because if you don't have an ORP retiree account, you're not eligible for health insurance. They do not give a dollar amount. The rule is just enough that can be annuitized each year, okay? For the rest of the ORP retirees, fine. Now, ORP benefits. There are no provisions in ORP to purchase service credit. And so if you have withdrawn funds from ORP, you're not eligible to go back and purchase those. You cannot transfer or roll over non-ORP funds into the plan, okay? So that is not allowed. So once you retire, you can't put funds into the ORP account. So you want to be really careful and work with your vendor to make sure it's set up exactly the way that you need it to be. Okay, now we're going to talk about benefits at retirement, insurance benefits at retirement. The criteria to be eligible for insurance is that you have to be vested in TRS or ORP and meet the rule of 80 or age 65. You also have to have at least 10 years with a GBP agency. GBP is Group Benefit Program, which is ERS, okay? You've had at least 10 years with us. And if you're an ORP retiree, you have to have an ORP retiree account. Now, grandfathered employees can be considered. You had to be enrolled in health benefits for 5 years on September 1, 2014. So ERS took a look at everyone on August 31st, 2014, and they said, who's been in it 5 years? If you had, you're grandfathered. But if you had less than 5 years on August 31, 2014, you fell underneath the September 1, 2014 rule that says you're going to be on tiered insurance. A grandfathered employee's health insurance, if they meet all the criteria for retirement, their insurance is going to be paid for 100% for the rest of their life and 50% for their dependent. If you did not have 5 years on August 31, 2014, then if you have 10 to 15 years at retirement, we're going to pay 50% of your health insurance for the rest of your life and 25% for your dependent for the rest of your life. For 15 to 20 years, we'll pay 75% for the retiree for the rest of their life and 37.5% for a dependent for the rest of the retiree's life. And if you have 20 or more years, then we're going to pay 100% of the retiree and 50% of the dependent for the rest of the retiree's life. Okay? So it's important to know where you stood on August 31, 2014. Coverage start date for retiree. So if you're retiring, say May 31, you don't have a break in service. Your retiree insurance, if you're eligible for it, comes up June 1. Okay? So you're going to get coverage right away. ERS will key that into their system. They notify Medicare and everyone. There may be a delay. I always tell the retirees there is a delay in getting you up in the system, but they always make it retroactive to the first of the month when you've retired. Okay? Now, health insurance at retirement. So let's say that you retire before age 65. There is no waiting period again for the health insurance or the optional coverage. And let's talk about optional coverage right quick. You, the retiree, can keep your life insurance up to 2 times. You can keep your dependent life insurance. You can keep dental and vision. Okay? And you keep the basic life that SFA pays for you. However, the basic life is a $5,000 coverage as an active employee. As a retiree, it's reduced down to $2,500. On your dependent life as an active employee, it's $5,000 and it's reduced down to $2,500 for each one of your dependents you have on there. Your health insurance coverage does not change. If you elect Health Select of Texas Secondary, the cost of it does not change. Your dental and vision does not change. It stays the same price that you're paying now. The dependent life, you're paying currently $1.38. It goes to $1.84 right now. Okay? Now, if you are age 65 or older and you retire, it's a little bit different because Medicare gets involved here. If you're still working for us and you're age 65, you more than likely already have Medicare Part A. Very few people sign up for Medicare Part B, okay, while you're actively working. But as a retiree, you need to have both. And so you will need to get with Social Security and apply for your Part B and make it effective first of the month before the last of the month that you retire. So if you retire May 31, you need your Medicare Part B to come up June 1. Okay? Now, at ERS, when you're 65 or older and we turn in your retiree insurance paperwork, they're automatically going to sign you up for Health Select Medicare Advantage. And they're going to sign you up for Health Select Medicare RX. But as a retiree, 65 and older, you have a choice of two insurances. As I said, Medicare Advantage, and the second one is Health Select Secondary. Let's talk about the Health Select Secondary first. It's the traditional that everyone is used to. You sign up for Medicare Part A and B, and it is your primary, and then you use this plan as a supplement to pay what Medicare does not pay, okay? Medicare Advantage is a different plan. It is the primary plan. Medicare is the secondary plan. A lot of people go, why do I need Medicare? For that plan to pay, you have to have Medicare A and B, okay? You will not use that card. You will not show it to your doctor, your Medicare card, to the doctor, to the hospital. The only card you will show them will be the Medicare Advantage. With Health Select Secondary, you would show them your Medicare card and your Health Select Secondary. But with either plan, according to which one you choose, both of them can use Health Select Medicare RX. Out at the ERS website, there's a really good comparison of these two plans and how they pay. So you can go out there and look at those and decide which one works best for you. I always suggest that you call your doctor's office and the hospitals and make sure who's in network and who they like using, okay? Now, as I said, if you have not already, you're 65, most people have already signed up for Medicare Part A. You will need to sign up for Medicare Part B. You have to have both plans. Medicare Part B has a cost to that, and it will come out of your Social Security check, okay? No waiting period for health insurance or optional coverage. It begins first of the month of when you retire, and you're automatically enrolled in Health Select Medicare Advantage, or you can elect Health Select Medicare RX. Right now, ERS allows you to choose between these two. You do not have to wait till summer enrollment to make a change. So if you get into one plan and it doesn't work well for you or you don't like it, you can call ERS and opt out of it and go into the other plan. What you need to keep in mind is, as a retiree, you're going to be dealing directly with ERS. So you will have to call them and tell them, hey, I want to be switched over. There is a rule out there for Medicare that you have to allow 29 days for that to happen. So if you call and say, I want to switch over, it's not going to happen immediately. You got to have a 29-day waiting period for Medicare and everything to switch, and then that insurance will come up the following month. Okay? We've gone over these already. Now, summary of what needs to be done for retirement, TRS retiree, you need to send off for your retirement packet approximately 6 months before retirement day. That's the ideal time to do it. But if you're deciding, hey, I want to go out, go ahead and send off for your packet now. They allow you to turn that packet in up to 2 months after you retire. So you're okay. Just keep in mind that it takes about 60 days to get that packet in. So I would suggest going ahead and requesting a packet. I do want to let you know, just because you're requesting a packet, that does not mean that you can't change your mind. It is not official until you sign that paperwork, send it back to TRS, and draw and cash that first check. Once that first check's been cashed, then you can't back out. But up to that point, you can get the retirement packet, look at it. If you don't want to retire, that's okay. You don't have to do anything with that. And TRS is not going to start retiring you. Okay? Now, ORP, you need to schedule your appointment with your vendor and sit down with them and work out how you want to draw your funds out of the ORP account, keeping in mind that you can never completely close that account out to be eligible for health insurance. So you need to maintain an ORP retiree account for the rest of your life that can be annuitized. Once you get that done, then you call the HR department, schedule an appointment to finalize your retirement insurance paperwork. And sometimes it's according where you're at on your age. If we need to do paperwork for your Medicare Part B, if you're just turning 65 at the same time that you're retiring, sometimes they don't require that paperwork. But just come see us and we'll be glad to look at that and get you the necessary paperwork that you might need. Okay? Now, another thing that you need to look at, if you're retiring before your full retirement Social Security age, you want to go out to Social Security and talk to them and make sure. They have rules out there about having 0 years not paying in to Social Security. You want to make sure that you're in, I think they say, sometimes they say 40 quarters, but they also say you have 35 years that you have worked to not be penalized for not paying into Social Security. So if you retire at age 57 and your full Social Security age is 67 and you don't plan on working, you got 10 years worth of blank years there, you want to make sure that's not going to hurt you when drawing Social Security. So we always tell everybody, be sure and talk to Social Security and see where you stand there when you're looking at everything at retirement, if you're wanting to retire or not. Okay? Now, if you have questions, email me at hunterbgsfasu.edu. My phone number is up there, or you can do our benefits email, and we will get back with you. I will tell you right now, we're being flooded with calls and emails, so be patient with us. We're going to get back to you. It might not be that same day, but we're going to try our best to. Okay? Now, there are some resources for you to go to. The TRS website, if you're a TRS retiree, we also have ERS where you can look at the insurance. We have Blue Cross Blue Shield that you can look at the Health Select Secondary. But in ERS, again, they have that comparison out there for you to look at. Here's the Social Security website, and we have the BenePlace where I'll offer some discounts that you might be interested in, and your vendor that you have with ORP if you're an ORP retiree. Okay? Again, I want to kind of just remind everyone, if you're interested in the VSIP, applying for it, it does not mean that you're eligible for it. It's just an application. And then we'll see if you're eligible for retirement in fiscal year 21. And at that point, we will process it up to the next level to see if you're eligible for VSIP. And we will call you in for an appointment in August, talk to you about it, talk about retirement, go over everything, see when you want to retire. And then those agreements will be coming out in September, okay? You're going to have up to 45 days to review those and sign them. But once they're signed, so if you sign it before the 45 days, you have 7 days from your signature to withdraw that. So it's not binding. I think that was confusing to everyone. We've had a lot of calls on that. And this is not something in lieu of your retirement. This is something you get in addition to your retirement. Also, we're going to put we have the Zoom website up out on the HR website. So if anyone wants to go out there and look at the Zoom, you can do that. But at this time, we're going to open it up for questions in here first. And then after that, we'll open it up to everyone that's on the Zoom. If you will, just raise your hand and Eric will be sure and
So for our audience here, if you have a question, just raise your hand. On Zoom, there is a little feature called Raise Your Hand. So click on there and that will alert me that you have a question or you want to ask a question. So let's go ahead and get started around here first.
Any of y'all have any questions? Okay. So we'll take the Zoom questions.
I have a question. I just want to make sure that I understand. You have to retire, I mean, the option is to retire sometimes this next year, correct?
Yes, fiscal year 21 for the VSIP program. Is that your question about the VSIP?
Yes, ma'am.
Yes, in fiscal year 21. So faculty, they gave the dates 12/31/2020, 5/31/2020, or 8/31/2020. For staff, those dates could vary. We're going to try our best to accommodate the date that you're wanting to go out, but we also have to look at the department, see how many people are going out, and make sure that everything is covered and taken care of. But again, we're going to try our best to work with the date that you're wanting. Okay? Next question.
I have a question. So why was the email that came out, if you're interested in retiring in 5 years, so we don't have 5 years to get the benefits from, we have to do it this next year?
For the VSIP incentive, it has to be this fiscal year.
Okay.
We've done this program just letting people know who's getting ready to prepare for retirement in the next 5 years, what you need to do. So it's two different things, okay? The VSIP is separate from retirement, but for fiscal year 21, it's being offered as an incentive if anyone is going to retire in fiscal year 21, that they might be eligible for the VSIP program.
I have another question. Do we have an idea of what is the benefit? What is the incentive that we get if we retire this year?
They're looking at doing 50% of your base salary. So it doesn't include any overloads or stipends or anything like that. It's your base salary.
Okay, thank you.
Mm-hmm.
Barbara, is that amount, the incentive amount, tax?
I can't hear
We
you.
can't hear you.
Is the incentive amount tax?
I still can't hear you. I'm sorry.
Would you repeat your question again?
Yes, is the incentive amount tax?
Something about with tax, about tax.
Is the VSIP taxed? Is that what you're asking?
Yes.
Okay. Yes, it is taxed, but retirement does not come out of it. So it will be taxed though for your Social Security and federal withholding. It's going to be at 29.65%. Did that answer your question?
Thank you.
Okay.
Okay, so we still have time. So as I said, if you have a question, if you would just use the feature, raise your hand through Zoom. That way we'll know.
If someone doesn't want to raise their hand, you can do it through chat, and Eric can pull that up as well.
I've got a question.
Okay.
Can you speak to first the criteria that are going to be used to determine who actually gets to participate in VSIP?
I'm actually not going to be the one doing that. So I think that, is Daisha on?
Daisha, you on?
Yes, I'm on. I can take this one.
Hey, Daisha. Would you repeat the question again, just so everybody knows?
Sure. So if I understand correctly, your question is what criteria will be used to determine who actually gets approved for the benefit?
No, what and how?
Okay, what and how? Okay, gotcha. So once eligibility for retirement is confirmed, so those baseline criteria, at that point we're going to be looking at kind of a number of things. So it depends on how many people in the department. It depends on some of the factors that we've seen in other conversations regarding budget, semester credit hours. It's gonna depend on a lot of different things based on how many people in one department are participating. We do know that we won't be able to approve every single one. One factor that will probably be weighed is who applied first in some instances. It's just we can't really say until we know the final list of people. And then at that point we'll be the compensation team will be meeting with the division and division heads to go from there once we know the people. But we can't really say what factors will pull one way or the other until we know exactly who's requesting to participate. Does that sort of kind of answer your question?
Yes and no. So there will be no ranking of the different criteria used. For example, you have somebody that may be 70 years old where the university may save, say, 2 or 3 years versus somebody that's 60 where the university may save 7 to 10 years of salary.
So age definitely will not be a factor, as that's a protected category. But what we will do, we will develop some type of matrix that's going to vary department to department based on their function in the university as a whole. But we'll develop some type of matrix that shows which positions will be able to or which employees will be able to participate and why, depending on that position, those other factors that I mentioned. But there will be a matrix. Protected categories will not be taken into consideration when we make those decisions, though.
Okay, so ignore the age, the years potentially of cost savings on the salary, which is independent of age.
Right. So yes and no, if I may, because depending on the position, we have to look at what market says that position is going to cost to replace. So again, it's really going to be a case by case on what positions are approved to participate or not. The overall goal certainly is FTE reduction for for this program and for other programs as well, but we're just going to have to wait until we see the final list to go towards making those decisions. And it will certainly be not necessarily HR's decision. It will be our university leaders weighing in on that for sure, based on all the factors that are pulling on our university at this time.
And given the president's transparency theme, will those criteria then be available so that someone can know, oh, here's why I wasn't selected to participate, or I was selected to participate?
I don't know the answer to that question per se. I don't think that those that are not approved to participate, there will be a reason accompanying it. And the agreement will speak to that a little bit more once they go out. But we're a state agency, so it's not like we can hide the information. But I don't think that it's written in the program that we have to provide those reasons. We've said in the announcement that it's, of course, due to budgetary issues and in response to that. So, as those factors are considered, I'm not sure how much of that will be released by the president.
Okay, just one quick follow-up, and that is, can someone speak to why the same amount, percentage-wise, is being offered instead of leveraging more money to save more money versus someone that may be retiring within a year versus someone that may be retiring 15 years before they are likely to retire?
That's a great question. In our research. We looked at 10 other institutions and kind of studied some of their programs and their success. As we kind of manipulated those values, you know, what the incentive would be, what the program rules would be, the 50% just stood out as being the best option. So there were other considerations for more or less on that incentive, and you know, other institutions I'm sure had different amounts, but that's where we landed just because of the benefits that it would bring and just the timeliness of that. So
Thank you.
you're welcome. Did I answer your questions?
This program looks suspiciously like Texas State's program.
Yes,
And
Texas State was one of the schools we looked at.
yeah, and I don't think the university's leveraging the money that they have to be able to save money long term, but that's just my opinion. So
Thanks for those questions. Very good questions.
Thank you, Daisha. Our next question is, if you decide to retire, are you or your dependents still eligible for LEAP?
And the answer to that is yes. They're gonna offer the LEAP program to retirees. You have a question?
Yeah. With the hiring freeze, will those positions be eligible to be filled?
I think that's something that will be looked at that time. That's part of it. I can't give you a definite answer on that one. That will be looked at the department level because they're looking at the FTE. It is a reduction of FTE and restructure of areas. And so they'll take a look at that to see.
Okay, when somebody asks a question here, would you repeat the question again? There's having trouble.
We have a couple, I think, that are more personal questions. And for those, if you will actually email us or call us, we'll be able to do those with you individually on that one. What about the next one?
So the question, there was a question that was asked if retirees or their dependents will qualify for the LEAP program. The answer was yes. The next question is, I was told that 72% of the BS money is used up already. Is that true? For the visit program?
We have not started approving anyone yet. We're waiting to the deadline to see who all is applying, get all of those, and then we're going to start processing those VSIPs. So we've had a number of people to apply, and I think that's where that 72% is coming in at. But as far as approvals, we've not started doing that at this time. Any more? Okay, if there's no more questions, be sure and go out to the website, look at the Zoom meeting out there. Again, if you have more questions, email us or give us a call and we will get back with you. Thank you.
Hey, Susan actually wants to go ahead and ask that question out loud. So. Hey Susan, you still there? I will get back to you via email, if that's okay.
So you don't know if the position will be just right now or?
No, I don't. They're gonna look at that.